Hello, I'm Dr. P.R. Krishnan. I'm Senior Consultant Neurologist. For the many years now, there is a therapy for stroke called as thrombolytic therapy, and there is another treatment called as thrombectomy. So these are the two major treatments for stroke now, which has evolved over the last few years. So the golden hour for stroke is considered to be 4.5 hours from the definite onset of stroke. So if somebody knows that they have been okay at say 6 o'clock in the morning, but they feel that they have developed some symptom of stroke by 6:30, then 6:30 in the morning is the time of onset. So if the time of onset is not known, like somebody who wakes up from stroke, then we will not know the time of onset because it may have occurred at 12 in the night or it may have occurred at 4 in the morning. We do not know. So in such cases, treatment becomes difficult and it requires more advanced imaging to decide whether treatment will be effective. So if the patient has any of the symptoms of stroke like weakness, any vision loss, any severe headache, imbalance of gait, any recurrent vomiting, and any loss of speech, and these are all the major symptoms of stroke. If any of these symptoms occur, then the patient has to come immediately to a stroke ready hospital. So a stroke ready hospital will be a hospital which is a large hospital which has an in-house MRI facility and also an in-house neurologist. So such hospitals are called as stroke ready hospitals and which offer stroke care. So the patient comes to such a hospital within the first 4.5 hours. So that is the time when we can consider giving clot busting medicine, that is called thrombolytic therapy. Or if the clot is very large and it is occurring in the large arteries, then the clot is removed by using certain techniques. So this is called as thrombectomy. So thrombolysis and thrombectomy are effective when the patient comes within the golden hour, that is within the first 4.5 hours. But it does not mean that the patient should wait for 4.5 hours. Earlier is always better because the amount of time that is wasted in commuting or in getting to a hospital will determine how much of brain cells are lost. So time is brain, and it is very important that the patient reaches a stroke ready hospital within the most minimum time possible, and 4.5 hours is just a number. No effect is always seen if the patient is treated within the first 3 hours.